All right, next item on our agenda is our Parkinson Awareness Month. And I am going to, do you have a copy of the Proclamation, Selectman LeBlanc,
Oh,
in your packet?
yes.
Do you have it?
Yes,
Do you have-
it's in our packet.
Well, I was going to turn this over to you since you're the one that,
Oh,
brought this to our attention for, and did not know if you wanted to talk a little bit for Tim.
sure.
How's that?
So to the remainder of the board, I had reached out to the town manager and to the chairman. Parkinson, I had Mr. Macmillan, who is a resident in the town of Oxford, had reached out to me and asked if the Board of Selectmen would consider proclaiming April to be Parkinson's Awareness Month. It is a very debilitating disease. I know that there are multiple people within the town of Oxford who unfortunately suffer from this. And so I was able to, with the chairman's approval and the town manager, we were able to issue a proclamation making this the Parkinson's Awareness Month. And Tim, if I'm correct, because we agreed to do April as Parkinson's Awareness Month, I believe our very esteemed governor decided to follow suit, correct? And declared the entire state as Parkinson's Awareness. Is that correct?
That is correct, Cheryl. Governor Charlie Baker has declared April as Parkinson's Awareness Month. Excellent.
Tim, before I read the proclamation into the record, would you like to say a few words to the town and to our officials and so forth, and what we can do?
Yes, I would like to thank the Select Board for proclaiming April as Parkinson's Disease Awareness Month and for allowing the opportunity to speak about Parkinson's. My name is Tim Macmillan. I live at 12 Woodcrest Drive, North Oxford. I was 45 years old when I was diagnosed with young onset Parkinson's disease, also called YOPD, back in February of 2014. Parkinson's disease is a progressive neurological disease, usually of later life, that is linked to decreased dopamine production in the brain. It was first medically described as a neurological syndrome by British surgeon Dr. James Parkinson back in 1817. Approximately 60,000 Americans are diagnosed with PD each year, and there are more than 10 million people worldwide that are living with PD currently. Parkinson's is complex. The typical symptoms are tremor of resting muscles, rigidity, slowness of movement, impaired balance, shuffling gait, and lack of facial expressions. Some not so common symptoms are loss of depth perception and dystonia, which is the involuntary spasming of muscles. There are many services provided for patients by doctors, physical therapists, and occupational therapists, but there are many organizations that offer programs specifically for PD patients. Such organizations that are out there that I partake in are Dopafit Parkinson's Movement Center, which offers boxing, which has been clinically proven to slow the progression of PD. Creative Neurology, which offers art therapy and a workshop for micrographia, which is small handwriting, another symptom of PD that works on the fine motor skills. Also, there is the American Parkinson's Disease Association, the Massachusetts chapter, the Parkinson's Foundation, the New England Regional, and the Michael J. Fox Foundation, and we are firefighters with Parkinson's.
All right.
Excellent. Thank you, Tim. And thank you for sharing your story. And we are honored to be able to proclaim this month. So I will read into the record, Mr. Chairman.
Yes.
Proclamation, whereas Parkinson's disease is a chronic progressive neurological disease and is the second most common neurodegenerative disease in the United States. And whereas Parkinson's disease is estimated to affect approximately 1 million people in the United States, and the prevalence will rise to 1.2 by 2030. It is the 14th leading cause of death in the United States, according to the Centers for Disease Control and Prevention. And whereas it is estimated that the economic burden of Parkinson's disease is at least 52 billion annually, including direct and indirect costs. Research suggests that the cause of Parkinson's disease is a combination of genetic and environmental factors, and the exact cause and progression is still unknown. There is no relatively, hold on a second. There is no objective test or biomarker for Parkinson's disease, and there is no cure or drug to slow or halt the progression. And the symptoms of Parkinson's disease vary from person to person and can include tremors, slowness of movement and rigidity, difficulty with balance, swallowing, chewing, and speaking, cognitive impairment and dementia, mood disorders, and a variety of other non-motor symptoms. Volunteers, researchers, caregivers, and medical professions are working to improve the quality of life of persons living with Parkinson's and their families. And increased research, education, and community support services, such as those provided by the Parkinson's Foundation and other organizations, are needed to find more effective treatment and to provide access to quality care to those living with the disease today. Therefore, be it resolved that the Board of Selectmen of the Town of Oxford proclaim the month of April in 2021 as Parkinson's Awareness Month, signed by Dennis LaMarche, Megan Troiano, Cheryl LeBlanc, Michael Daniels, John Sad, and Jennifer Callahan. And we are thrilled and very happy, Tim, to allow us, thank you for allowing us to spotlight a little bit on this, and hopefully it'll be of some help to someone.
Thank you, and I appreciate that. The more awareness we can get out there, the better.
Absolutely. Thank you,
All
Tim.
right.
Thank you.
Thank you, Selectman LeBlanc. I would just like to comment that it's an awful disease, and there are so many, and it's just something that unless people go through issues where they have people that have such a tough disease as Parkinson and is involved with that with a family member or a friend or something, I wonder sometimes if people really understand it. And I personally can feel your pain. I understand. And I can't imagine what you will have to live with now and in the future. So I just say God bless you and wish you very well.
Thank you, Mr. Chairman.
You're welcome. Any other comments? All right, we thank you very much for coming, Tim.